assessment continued. This is John Doe, and we're going to continue and going to go ahead and do our cardiac assessment and our respiratory assessment. Initially, I'm going to listen to the lungs using the diaphragm of my stethoscope, just sort of straight. When you feel my stethoscope touch you, take a nice deep breath in through your mouth and out and out. Okay, I'm going to listen up here. Respirations are even and unlabored. I'm also going to try and see how well the lungs feel. I'm going to put my hands right here. Nice deep breath. And out. They are even, symmetrical, unlabored. Respirations were about 20 when we started the assessment. Lungs are clear bilaterally with no adventitious sounds. I'm going to go ahead and assess the lungs from the posterior area. Deep breath in and out and in and out. Again. Very good. Very good. All right. I'm going to go ahead and assess cardiac sounds, and I'm actually going to do this with him sitting up for better visualization, but I'm also going to discuss what points we're listening to as we go and what intercostal space. Usually we start with about the second intercostal space, starting at the clavicle, and you just count intercostal spaces all the way down, and it's usually your fingers will lie just nicely inside of them. The second intercostal space down on the left side of the chest is your aortic valve, where you hear it best. The pulmonic is the second intercostal space down on the left, and that's where you hear the pulmonic valve the best. If you're going down to the fourth, you're going to be at the tricuspid valve area, and then fifth is mid-clavicular. It's usually right mid-clavicle or mid-clavicle, straight line down, fifth intercostal space. This is the point of maximum pulse, and it's also the mitral valve area where you hear, and sometimes when you can't hear it there really well, you can have the patient turn on their left side for a little bit better sound. But I'm going to go ahead and assess these areas with the bell and the diaphragm. I'm going to start with the diaphragm. Now, just breathe normal for me, okay? Again, this is aortic. Pulmonic. Tricuspid. Fifth intercostal space is Erb's point. I didn't mention that. And it is also the point of maximum apex of the heart, maximum impulse. No, I don't hear any murmurs again. Very good. So that completes the respiratory and the vascular portion, and we will continue these assessments.